Good day to all of you. Welcome back on our show of Health Talks. In the previous episodes, we had discussed about lifestyle. We've discussed about exercises. We talked about the benefits of exercises, what exercises can do to us, what are the effects of exercises, and how these effects are beneficial to us. About lifestyle. Now, a lot of diseases are very much related to our lifestyle. Now, some of these diseases which are related to our lifestyle are heart disease, high blood pressure, diabetes, and lots of types of cancers which are related to our lifestyle. It simply goes to say our choices, the choices that we make in our lifestyle and the types of choices that we make will decide on our health status. If you want to have a healthy lifestyle, you want to have a healthy life, we need to have a healthy lifestyle. A healthy lifestyle, chances are with a healthy lifestyle we'll get a very healthy life. Among one of these diseases that we had just mentioned is diabetes. Now, if you were to drink 3 or 4 glasses of sweet syrup or sherbet, and you find your blood glucose level is still the same. On the contrary, on the other end, if you were to fast for 2 or 3 days, you'll find that the blood glucose level is still very much controlled, is still pretty much the same. This is the ability of the body to maintain an optimum blood glucose level, which simply means the amount of glucose that's found in your blood will be controlled. Now, when the body loses the ability to control the level of glucose in the blood, that's what we call diabetes. That's when you have diabetes. Diabetes is the inability of the body to control automatically the glucose levels in our blood. This regulation of the blood glucose in our body is done by a hormone called insulin. Now, when the pancreas does not produce insulin, you have a certain type of diabetes which is known as the type 1 diabetes, which simply means there's no insulin in the body, and then we need to inject the body with insulin. We have type 2 diabetes where there is an insulin production, but for some reason the body does not respond to this insulin. That's type 2 diabetes. Type 2 diabetes is much more common than type 1 diabetes. We see it in individuals above the age of 30. Very common with those who have a very poor healthy lifestyle, a poor lifestyle which is not so healthy. They are inactive, they are overweight, they eat lots of sugars, they have a sweet tooth, and they smoke cigarettes. There's a lot of consumption of alcohol. That's based on lifestyle. Now, changes that are brought about into this lifestyle can help to control type 2 diabetes very well. As a matter of fact, in the early stages, a lot of individuals have been freed, have been spared from type 2 diabetes just because they made some changes in their lifestyle. They became active, they started exercising, they did away with all those foods that they should not be taking, they should not be eating and drinking, and guess what? They got better. And the dependence on drugs then becomes very much low or even not at all. A lot of individuals control their diabetes simply by exercising and adopting a healthy diet. Now, diabetes, apart from having uncontrolled blood glucose levels, which is either too high or too low, both extremes are not recommended. We don't want them. This is not what we want. We want optimal levels. Now, what's dangerous of diabetes is the complications that arise from diabetes. Diabetes can bring about a condition known as atherosclerosis. This is some abnormality that takes place in the blood vessels. They become thickened from the inside because they get layered with plaques and cholesterol, and they become hardened. So the blood vessel will lose its elasticity, and fine blood vessels which are found in our brains, when that blood vessel is exposed to high pressure. We've got blood pressure. Each time the heart pumps, there's an increased pressure, but because the blood vessel does not expand, it has lost its elasticity, it ruptures. And when it ruptures, it causes bleeding, and that bleeding that takes place in the brain brings about a pressure on the brain cells, and that is what we call a stroke. And the result of this would be paralysis on one side of the body. So we have problems or complications that are related to the blood vessels. We can have complications arising to the skin, where the skin does not respond well, it does not heal well. Patients with diabetes, people who have diabetes, they will constantly be scratching, especially where there are folds like the underarms, around the groin or the hip region. The skin has got very poor health and it's always in a very bad state, and there's some regular scratching and some discomfort there. Diabetes can bring about weakness in the eyes. Lots of diabetic patients end up having glaucoma. They have blurred vision. It can bring about weakness into the nerves, a condition known as neuropathy, where the nerves die. So with that, what happens? They lose sensation. There's no more sensation. So diabetic patients, if their glucose level is not controlled, and if they have this complication of neuropathy, they will have no sensation in their feet. They may end up stepping on a nail or a glass or any sharp object and have a wound in their feet or foot, and they will not even know about it. Now, we've seen patients coming to the hospital with a very bad wound. We have seen patients coming to the hospital with a sharp object stuck in their foot, in the heel or in the ball of the foot, and they don't even know about it because they've got no sensation. We have patients who have burned themselves because they were trying to give some heat therapy to themselves, but because they've got no sensation, they cannot tell how much heat is required. Now, what can be the worst case scenario of people having neuropathy who have lost their sensation of their feet? Worst case scenario, they have bad wounds, and another complication of diabetes is these wounds just do not heal well. And because they don't heal well, they get very badly infected, and a lot of patients end up with amputation of their toes or the foot or of the whole lower limb, simply because they had no sensation, and they had no sensation because they were not careful enough, and they're not careful enough, and the result, all of this is the result of diabetes. Another complication of diabetes is nephropathy, where the kidney starts to fail. So we're looking at all these complications, and the cause of most of this complication is poor blood supply to these areas. The glucose levels are not in the optimal levels, and we can end up with all these complications. We can end up with heart problems, we can end up with kidney problems or renal problems, we can end up with nephropathy, neuropathy, retinopathy, where the retina, that is a part of the eye, it starts to degenerate much faster than it should actually. So we want to make sure that we do not go into all these complications. And one of the best methods into not going into this complication is to control. If we are already diabetics, then we want to control the diabetes. There are a lot of individuals who are on medication, but for some reason the body does not respond to this medication. Now, why doesn't the body respond to this medication? Again, the body needs to be activated. Because the body is not activated, it does not respond very well to the medication that is being taken. But what we really want to look at is being able to prevent all this, because studies show, research shows that these can be prevented. It's not a foolproof or 100 proof, but it can definitely reduce the risks. And among all these risks is being overweight, being inactive, because most diabetic patients are overweight and they are inactive. So we want to reduce this, and that's where a healthy lifestyle comes in. We want a lifestyle whereby we are active, we exercise regularly, and we take a healthy diet. Now, what happens when one exercises? Apart from other benefits of exercises that had been mentioned in the earlier episodes, one of the benefit of exercise, or the effect of exercise, I would say, is that the glucose in the blood is used to generate energy. Now when that glucose is used up, so what happens to the glucose level? It starts coming down. It starts activating the body systems. The body functions better. So this glucose is used up, and in that way the glucose levels are down. Now diabetic patients who exercise regularly are known to have far less risk of having complications that were mentioned earlier, compared to those who do not exercise, who are sedentary, who are still overweight, and who are not careful with what they eat. They just depend on the medication. They eat as they like, they pop in the pills to bring down the glucose levels, but in the long run the body is not benefiting at all. So what we want is the body to benefit in such a way that we are away, we are free from the complications. And for those of us, most of us who do not have diabetes, we want to make sure that we don't contract such a disease. And to prevent ourselves from contracting such a disease, we have to be active, we have to be in our ideal body weight, and we should adopt a healthy eating habits and exercise regularly. Now that's not too difficult to do. It's something that all of us can do, but most of us choose not to. So when we talk of lifestyle, we are talking of people who choose to do things which brings them pleasure. But as Guru Maharaj says, "Bahut sadho dukh prapat hoye." If we overindulge ourselves in a lot of things which do not bring us any benefits besides pleasure, and Guru Maharaj says, then we are going to be facing a lot of pain and sorrow. And that's exactly what happens. If we choose to sit in front of the television for 1.5 hours, 2 hours, or half an hour, and say that we don't have time for exercises, well, somewhere along the line we will be paying the price for it. To be in the ideal body weight, now it is recommended that for a man, for a male, the waist should not be more than 35 inches. And for a woman, she should not be more than 33 inches. Now this is a very clear guide of how overweight we are. We can just pick up a tape measure and measure our abdominal girth. Will be just over the umbilical or the navel, and see what's our waistline like. Now if as guys you are hitting beyond 35, you know you are really overweight. And ladies, if you're hitting beyond 33, you know you're really overweight. Now that's the max that you would want. You would not want to go beyond that, but you definitely would want to go below that. And of course the waistline is going to vary with our sizes, with our height. If you have a bigger frame, it's going to be 35. If you have a smaller frame, someone like me, it's going to be 32. And the same thing applies for the women. Now that is pertaining to body weight. Now we do not want excess body weight. Excess body weight comes from excess calories that we have taken into our body. Now the calorie is the amount of energy that is produced by a single gram of food, be it from the protein, be it from the carbohydrates, or be it from the fats. Now we want to make sure that we are just taking the right amount of calories in our daily diet. Now how much calories do we need? Now we can get this information from the internet, we can get this information from a physician, you can definitely get this information from a dietitian or a nutritionist. Now all this information is readily available. Now what happens when we overeat? There's excess glucose in our system. This excess glucose in our system, after it's been used, whatever that is left is not being used, is stored as fat. Now there are two schools of thoughts. Now one school says that we should reduce on fat. Another school says that we should reduce on carbo. Now some authorities say that one should adopt a low carbo diet, and there are other authorities that say we should adopt a low fat diet. Now both schools of thought have got very good evidence, and they've got very good explanation and understanding provided why one should adopt a low fat diet or a low carbo diet. A low carbo diet was proposed very strongly by Dr. Atkins, and it has been around for quite some time now, and a lot of people do adopt this low carb diet, low carbohydrates. When we talk of carbohydrates, we mean anything that's made of refined sugars, white flour, sugars, pasta, rice. And when we talk of high of wholemeal, we should be taking wholemeal diet. Wholemeal is wholemeal flour and brown flour, brown sugar, which we would call as shakar, and white sugar is refined sugar, and this is bad for the body. Now, low fat diet simply means reducing the amounts of oils. Margarine is definitely out of the picture. We want to reduce butter. Anything that's has got to do with oils, we want to reduce that. That's going on a low fat diet. We would want to stay away from fried foods, deep fried foods. So this battle between low fat diet and low carbo diet is still an ongoing thing. But what we should do is we should adopt a habit where we just eat what we need, not what we want. Now, eating is a habit. Now, if you eat 2 bowls of rice every day, and when you start eating one, you're not going to be happy about it, because the body has got used to eating 2 bowls of rice. But if you start eating one, eventually 2 will be too much for you, because the body is now used to eating 1 bowl of rice. Now, that's the beauty of the human body. It can adapt itself to whatever measures, to whatever practices or habits that we train our body with. The body will learn, the body will train, and the body will agree with it if we let our body do so. But if we have trained ourselves to be in front of the telly at 6 p.m. to 9 p.m. every day, then that's what our mind wants, and that's what the body gets used to, that's what the body gets accustomed to. Now, if we start exercising, we may not be happy with our exercises. We may feel aches and pains, but within 2 weeks, the body gets used to it. Then there are no more aches and there are no more pains. And the day you start missing your exercises, you know you're on the right track. But as long as you tell yourself that you're not happy exercising, you're definitely not on the right track. So a healthy lifestyle is having a good, healthy diet, eat good eating habits, having time allocated for exercises. We should have enough time to exercise every day. We may want to rest for a day or 2 in the week, but for at least 4 to 5 days in a week, there should be regular exercises, regular activities, which as we go along in these episodes of ours, we will be demonstrating some simple stretching exercises, some resistance training, and some aerobic training, which we'll be talking about at greater length, just to get ourselves acquainted with what is exercises, what is aerobic training, and what is anaerobic training. In the last episode, we spoke of aerobic exercises, exercises which are done with the continuous use of oxygen. Anaerobic exercise is an exercise system which is a system where the energy is readily available. For instance, if I just lift my arm up like this, that's an anaerobic activity. There is enough energy in this arm of mine to allow me to do this. I need not do any stretching, I need not do any warm-up. I can lift up a weight. But if the weight is too heavy, I can lift it up only once. When I try to lift it up the second time, I can't do it, because whatever energy that was stored in this muscle has all been used. Now that's anaerobic. Now I can do an anaerobic activity even by holding my breath. I can hold my breath and lift it up. But an aerobic activity like going for a walk or for a jog or for a run, I have to continuously breathe. I have to keep breathing. And that activity is going to be a long activity. Now an anaerobic activity, I can make a 40-meter dash just by holding my breath. I can jump by holding my breath. That's the use of the latent energy, the energy that's readily available in our muscles. Aerobic activity is where the muscle continuously produces energy. It generates energy by using the lactic acid. We had mentioned about the acid, which is an end product of activity. That is lactic acid, which is found in our muscles after the muscles does some activity. that activity, that lactic acid is also reused together with the pyruvates and the triglycerides to generate energy. Now this goes on continuously. As it goes on and on and on, and you find that the body needs to use more, it needs to produce more energy, then it starts using the fats that's found in our blood. And with that, a lot of calories are burnt, a lot of fats burnt, and there are a lot of other benefits which will come into action, and we enjoy the benefits of exercises. So this is all the time we have on this episode. Till we meet again and talk more about health matters. Hope you have had a good day. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.